So Dr. Walker is a board-certified surgeon that's been with us for a number of years now, and he's going to be talking on a new technology that we recently installed. Shortly after everything, he's going to do a little live demonstration, as long as my horse isn't lame and behaves. And so this is a new way that we're evaluating lameness and gait asymmetries using motion detection. So I'll turn it over to Wade.
Thank you. Thank you, everybody, for being here. It's a really wonderful turnout. And as I bore you through the next 15 minutes in equine biomechanics, just look around the room. This is our horse community here in Santa Ynez, and I think it's really unique to the rest of the world. Everyone here is for the horse, and it's really powerful, so thanks. And Ridgecrest and maybe Las Vegas, Lake Tahoe, all around the state. Thank you. We are going to talk about our novel optical motion detection camera system to diagnose asymmetries and lameness in the horse. This is the first of its kind in the United States at private practice. There's about 5 or 6 in Europe and 1 at a university in the States, but we're really proud. We got it in about a year ago, and we've been learning a lot about it every day since. There are always some IT glitches. Every day we learn, and we're getting better and better, and it's just going to keep spiraling in the future and get better and better. So who here has had a lame horse? I'm surprised there's some hands that didn't go up, and I want to talk to you and see what you're doing after, but I know all of you because I've seen lame horses with you, and all that is it's an abnormality in gait due to a pain in the locomotor system. And we see this as an unloading of the painful leg, so off on ouch, right? So when that lame leg goes up, the head goes up because it hurts. They're trying to get weight off of that. And that's what we're looking at visually. And we subjectively grade that with our AAEP grading scale between 0 and 5, 0 being totally sound, which there aren't many of those, and 5 being totally lame, can't put any weight on that leg. Fortunately, there's not many of those two. That's usually an abscess or a fracture. More commonly, it's a grade 3. Maybe 80% of the horses coming in here might have a grade 3 lameness, and that's a consistent lameness that we can see under all circumstances. So at the straight line or at circles, just we constantly see it. But that's a subjective grade, and that's just done with human error and influences that humans unfortunately are subject to. So there's a lot of bias or placebo effect. So for instance, if Ellie comes in and tells me Quintano's tight in the hocks, needs his hocks injected, he really responded last time, I flex him off, he flexes, we look at him again in 6-8 weeks, and both her and I are gonna want him to look better. Me medically, because I told her it would help, and her because she spent about $500 to get those hocks injected. So that grade 3 maybe just became a grade 2. Whether that was accurate or not, I'm not sure. And this subjective bias is so significant that in subtle lamenesses, so grades 1.5 or less, veterinarians with 20 years of experience only agree 52% of the time. So that's a flip of a coin on lame horses as to what leg is it and how lame is it. And that's really poor, so we need to do a lot better. We do other manipulations to help us increase our confidence as to, hey, where's the lame leg and how bad it is. So those are the flexions you're seeing us doing, different surfaces, circles to both ways. Sorry, I use my hands a lot. I'll point really obviously. Okay, and furthermore, these lamenesses are super complicated. So we all know these lamenesses are not one leg. They're always multiple leg involvement. There could be multiple pathologies in the limb, so maybe a navicular bone, a superficial digital flexor. Axial skeletal disease comes into hand, like kissing spines or cervical vertebral osteoarthritis. Potentially neurologic disease could be affecting things as well as rider interaction. So it's way more complicated than just watching a horse unload one lame leg. And what we can do to learn more about the horse or how it moves is use these lameness patterns. So there's some constant lameness patterns. When a horse, let's say it has a left front lameness, it's going to unload that left front head every time that foot strikes the ground. It's going to unload the left front withers, and then on the diagonal, it's going to unload the right hind pelvis, and that's a 4-limb lameness pattern of a left front horse. Conversely, in a left hind limb lameness, that horse is going to unload the left hind pelvis. At a diagonal, it's going to unload the right withers, and then again at the diagonal, it's going to unload the left front head. And these are the lameness patterns we can use to better diagnose lameness in a more sophisticated sense. So the goals at Alamo Pintado was to acquire a sophisticated motion detection system that would help us diagnose really subtle lamenesses or multiple limb lamenesses, complex lamenesses where multiple limbs are involved. We also really want to record and monitor known lamenesses so we can know our therapy is working or our surgery is working. Is this lameness getting better or worse over time? That's our assessment of response to treatment. We also, as an industry leader, want to really enhance research as far as lameness and these treatments go. And the truth is, a lot of the science up to this point has just been on these subjective analyses, and who knows what the bias effect is there. Surgeons really think their horses get a lot better than maybe they do. And then finally, the ultimate goal for this system is to prevent significant injury. So we want to get to know your horse. We want to see it run through on a consistent basis when it's really performing well, when it's succeeding. And then when we see little asymmetries off the norm, maybe that's when we diagnose disease and intervene before we run into career-limiting or catastrophic injury. So there's several ways to do this, to look at kinematic or kinetic motion in the horse. We looked at several of them. One is force plates. That's measurements of ground reaction forces as the horse's foot hits the ground. It's very sophisticated, but there's a lot of error because those horses don't like jumping on a plate. We have an inertial motion detection system here. Many of you have probably used called the lameness locator. We put a little hat on their head and another sensor on their pelvis. And with wireless technology, we can kind of see some variations in their stride. But we looked into the experts in the human sports medicine field, and we wanted to know what they were doing for the human athletes at a professional level. And it became clear quite rapidly that optical motion detection is the most sensitive way to do it. So here's a little example in swimmers. This is a professional swim lab, and they've applied several reflective markers at all the pivot points of this professional athlete. And what they're going to do, they're going to monitor this athlete dive into the pool, they're going to monitor it kick off, and they're going to measure differences in the way it moves with its stride. And this is kind of the system at work. And with that, they can monitor progress, they can monitor inefficiencies, and they can monitor problems before they become career limiting. So this is our motion camera system. It's right behind us. We'll be doing a live demo in about 45 minutes. We have 12 high-speed infrared cameras set to 100 hertz, sampling frequency. This is the bird's eye view of the system. So the black circles would be the cameras. The yellow shadow is the amount of area each camera can see. Anytime there's overlap of two cameras and a reflector's seen, we get a stride parameter pickup. We can run the horses through at a straight line. This is the stick horse running through our system at the straight line. We can do further manipulations through the system like flexions. We can block through the system to see where the location of injury is and help prove that with the system. We can also lunge circles through it. Now it's only 32 feet in length, or in width. It could be expanded someday, but the horses have to be under control. It can't be a crazy 2-year-old horse. Otherwise, there's pulls and danger involved. We can also do under saddle evaluation through the system. The only catch being, if your tack is reflective or chrome, that can be picked up as a sensor, so we have to cover that with vet wrap or something non-reflective. Here are the sensors being placed on the horse. There's 3 that go on the forehead, 3 that go on the withers, and 3 that go on the pelvis. And all the recordings on the head are going to be recorded in blue. In the withers, it's recorded in green. And in the pelvis, it's recorded in the yellow. Anytime there's an asymmetry on the left, that's recorded with a negative parameter. And on the right, it's recorded with a positive parameter. And again, seeing the horse's stride at these 3 body segments can really help us pick up these lameness patterns. So this is just one marker, the central withers marker, and this is how the horse moves. So you can see at the bottom of the sinusoidal curve, that's when the left front hits the ground. And as that horse pushes off, that withers rises in amplitude until it drops again before right front impact. And again, the right front push-off phase of the gait is seen with that reflective marker on the central withers, again increasing in amplitude. This simple graph can give us 8 data points, seen there on the left. Range up difference out of simplicity is all we're going to talk about today. But we can also look at push-off, impact, hip and shoulder hike at both the swing and stance phases of the gait. So it's robust information, almost too much information to take in, but hopefully as we do more and more of this, we'll know the meaning of all of it. So we're just going to talk about range up difference today, and that's one parameter we can get at one marker. This happens to be the head, recorded in blue. The range up difference is the overall upward movement between two halves of stride, or the difference in vertical excursion of the head in this case. And in this horse, had a negative 27 millimeter range up difference. So it means it has a left-sided asymmetry of 2.7 centimeters. I was going to go through a little case and show you how we can use this and where it's going in the future. So this is Z, a horse from Bakersfield, 10-year-old warm blood gelding used for a jumper. Came up severely grade 3 out of 5, left hind lame, 3 weeks prior to presentation. There we go, thanks. So here's the summary plot. This is the plot we're mostly going to show you because it's the most simple to see. So wherever a vector's going, that's where an asymmetry is, okay? And most significant here, you're going to see a negative 52 millimeter asymmetry at the yellow pelvis at the left hind. You'll see a 3.9 millimeter asymmetry on the right withers in the green, and a negative 62 millimeter asymmetry at the left front on the head. And again, this is that classic left hind lameness pattern. You have unloading of the left hind pelvis at the diagonal of the right withers, and again at the diagonal of the left head. So we really think right away, although there's a lot of asymmetry in that left head, we think this is a primary left hind lameness pattern. Next thing we can look at is stride-to-stride variation and how this horse moves. Again, blue is the head, and you can see the stride is a little bit more wide, and that's because these horses are looking around. They're looking at the sensors, they're looking at the other horses, they're looking at their owners. That's actually a really tight window for the head on a horse. You can see the yellow cluster and the green cluster of the withers are really tight, so we know this is a really good run. Maybe in a horse with multiple limb lamenesses or neurologic disease, these spreads are going to be a lot wider potentially, and we're looking at that as we go into the future. This is a really exciting plot. This is the temporal plot. So this is the stride over time, really over 90 seconds. We run them through 4 or 5 times, or 3 or 4 times, 8 times total, over 90 seconds. And this is for these lamenesses where horses are working out of it. They're getting better as they go. Or we can use it on flexions. Hey, did the flexion really exacerbate the lameness and improve over time? And you can see here, this is again Z, but on the left front, that blue, that compensatory lameness is really coming to midline. So that left front compensatory lameness is improving over the 90 seconds, where the left hind lameness in yellow is perfectly consistent. That one does not change over time. The other thing we can see here, and it's going to be really hard for you to see, I apologize for that, the red arrows show little squiggly lines, and that's tracking. So we can track how the head and the withers move together and how the withers and the pelvis move together. And is this horse running at a perfectly straight line, or is it running at a diagonal because potentially it has a little axial skeletal disease? Finally, we can dig into the stride characteristics at all points deeper. And again, what you have here is for Z, you have a left hind impact lameness with a compensatory left front push-off lameness, which is really common with a left hind primary lameness. So we worked this horse up and we did some nerve blocks. That's to block out the sensation to the area of pain. And this horse responded really well to what's called a low 4-point nerve block. So 4 nerves right above the level of the left hind fetlock. The area that was desensitized is visualized in pink there. So here's after the low 4-point block. And this is really impressive because what you'll note is that asymmetry on the left hind went down from 52 to 23 centimeters. But more importantly to me, that classic left hind lameness pattern at the diagonal is gone. Now that left front, without manipulating the left front, went from negative 62 millimeters down to 6 millimeters. We never even touched it, but this horse has completely changed the way it moves. And that's a really good block on a horse. We took some x-rays. This horse also had a bone scan or nuclear scintigraphy, and you can see there's a really hot spot at the top of the long pastern bone right into the fetlock joint. And that's a subchondral bone cyst going into the fetlock joint. And those are really, really painful for these horses. So we put a couple lag screws in compression right through the cyst, and we rechecked the horse at 4 months. And 4 months post-op, again, we have no sign of a left hind lameness pattern. What we have is this mixed left front lameness with a left hind component. And again, I'll remind you, this started with a left hind negative 52 millimeter asymmetry. After blocking, so taking out the nerves, it went down to a negative 23 millimeter asymmetry. Now we're at negative 18 millimeters, so we're even better than blocking. We're at 4 months out. We thought our surgery was a 6X. This horse went back into full training and is still doing well. We're about 6 months on it. So that's Z. So what Z teaches us is lameness really isn't just looking at the vertical displacement of one body segment. It's looking at how the whole horse moves together, and unfortunately our eyes just aren't sensitive enough to pick all that apart, but we're using technology that can help get us there. And furthermore, especially important to me, is these quantitative parameters can help us look at response to treatment. So do we really need to inject the hocks, or maybe we can wait 6 months? Or are we using the right therapy? Maybe instead of cortisone, we should be using PRP. We can check all these things now. And we can also make sure our surgical therapies are working as well as we think they are. Okay, so the future. The good news is the cameras are in, the computer's installed, we're learning how to use this stuff, and as the software gets better and better and becomes validated in the scientific research, we can apply more sensors. That's easy to do. So we can put them all the way down the neck, we can put them on the back. Potentially we could put them down the limbs, but horses tend to change the way they move when you do that. But we really have a lot of potential to diagnose really hard diseases like neurologic and axial skeletal disease. I'm most excited about assessing response to treatment and surgery. Potentially we might be able to tell you, hey, based off the way it's moving, maybe that's navicular bone and not superficial digital flexor tendinopathy. We'll see if we get there. But the most important thing about this system is maybe we can prevent injury before it becomes career limiting. So if we know how this horse moves, we see it every couple months while it's doing well. When it's a little aberrant from the normal, maybe we can diagnose the problem then, rehab or treat it appropriately, and prevent career limiting injury. A lot of people to acknowledge to get a system like this in place. There were 3 European vets that we're really working with constantly to improve on training, Dr. Benoit, Hardeman, and Rolfstroff. The Alamo Pintado team here, all the doctors are using it pretty much, and to get everyone on board, it takes full buy-in, and they've really done that. Dr. Susie Kahns, our in-house epidemiologist, who's really responsible for the research moving forward and to see how our therapies worked. Ashlyn Frost is kind of the fix-it person anytime something goes wrong. Her and Carter Judy's also helping with IT. My dad's in the audience, vet for 41 years, strong mentor. And then you guys. You're the reason we have this. Your dedication to the horse is why we get to do our job. And we're really proud of our clientele, so thank you.
That's great. We got 2 6'5" guys that cried today. So, yeah, that's awesome. No. So we'll go ahead and take some questions. Like I mentioned, we're going to do a little virtual tour of kind of our system and stuff, and Wade's going to actually do a live demo here in a little bit once we're all done out back. And like I said, if my horse is lame, just don't tell me, and we'll go from there. He probably will be. Okay, let's see. We'll take some questions.
All right, Ken. Rona.
Okay, Wade, if we were using this on a routine basis, how often would you recommend that we do that?
So it's going to depend on the rigor of the schedule. But right now, we're at every 2 months. That's the clients we're working with that have chosen to do this are coming in about every 2 months. And some interesting things have happened. Maybe we're not injecting hocks anymore every 6 months. That might be pushed out to 8 months. And we're just changing a little bit of the routine stuff based on how they look. But short answer, we think 2 months is probably the best recommendation.
Is this something we can do when we don't spot lameness, so we have a baseline?
Well, that's a great question. So everyone loves to ask about the pre-purchase, right? And currently we're not doing it on pre-purchases, although it has been researched for that, so that could be offered, but it often, similar to taking x-rays of backs, creates more questions than answers, because I would argue no horse is perfectly symmetrical. We know the standard deviations, that's been published, and we can accept that, but if you're having no problems with your horse doing exactly what it's doing on your routine, I would recommend not doing it, unless you're one who's in high-level performance and wants to diagnose something before it happens. But if all is well, we are good at finding problems, and you might not want to know. I bet your horse has a little lameness. Okay, we'll be doing a demo in about 45 minutes. Oh yeah, one more question. Yeah.
Hi, just a quick question. Do you put a horse through all their gaits when you do this, or is it walk only?
No, great question. Thank you.
And if you have a gaited horse that doesn't trot and blah, 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 that might not
It's
trot.
a no-go. We cannot do gated horses right now.
Well,
Sorry, wah, wah. The algorithms don't allow it. It's a European system, not many gated horses in Europe right now. So anyway, the answer is no to gated horses, and the analysis is performed at a trot because that's the symmetric gait pattern of the horse. So it's not the walk or the canter. Thank you.